Yep. Perfect. All right. So let me give you a little intro. So I'm just going to give Dr. Brittany a little intro. So she's over at Alpine Air and Wellness. She is so good at being a dentist that she decided to do continuing education to understand better how we breathe, how every bone in the bone in the skull should form properly, align properly, and then if there are some issues, she's taking stuff kind of like what chiropractors do is we find where the issue is, try to get it realigned, and we have been talking since I've been here to have her come over and do an awesome presentation that we've been so excited for. Because Dr. Bill and I want to learn a lot of what she's been going through, and so we get a little taste of it tonight. So Dr. Brittany, there's that, and then we have some people online, so I'm going to be monitoring for questions. Okay. And they can all let you know.
Yeah, just let me know, and feel free to like interject and ask questions as they come along. I feel like it's easier to ask questions as you think about them rather than wait. So let me just see if I am here so I can get that into slideshow mode for you. So thanks, Josh, for the fun intro. My office is this building over the red brick building. So just right close by. I started my journey with different things because my mom has severe sleep apnea. And when my mom would be in my dental chair when I was doing general dentistry, she would be out sleeping, sawing logs, and I wanted her to live to meet my kids, meet her grandkids, and everything like that. So I started down this journey of finding out how our body is affected by sleep apnea, and it turned into a career for me. So it was pretty life-changing. I like to throw this slide up. Any of those sticking out to you guys here? Yeah. What's interesting is all of these are related to your whole body, obviously. So chiropractic is going to help a lot with different things, but so can dental work because we're all about alignment. And so if we can get our jaw in good alignment and our airway as optimally developed as possible, it can help with a lot of these issues. Anyone particularly popping out at you? Take the question with snoring. Breathing. So we will be talking a lot about how snoring can affect the airway and how mouth breathing in particular can affect the airway because you end up with your tongue down low, and the tongue should actually help develop that palate. So yeah, we will keep tuned for that. A lot of the things is, hey, you come to learn a lot of good education, which is awesome. But then also, what pearls can you take away that you can do by yourself at home without actually having to come see me in the office? I would love to see you treat you in the office, but here are 3 major things that Matthew Walker, he's a neuroscientist and he wrote the book Why We Sleep. 3 things you can do starting tonight to help you with your sleep. 1, consistent bedtime. That's weekends and weekdays. So instead of staying up until 1 a.m. binging on your favorite Netflix show on the weekends, if you go to bed normal, that you normally do during the weekdays, when you go to wake up, your circadian rhythms are balanced and you can wake up without an alarm. It's a really cool body hacking thing that you can do. I can also eat my own words a little bit more often too. So if you sleep in a 68-degree temperature house, so you want, with the cool temperatures, it sets our body up to be in the right rhythms for sleep. So a cool house, and then also ones that we can all work on, no blue light the hour before bed. That's screens, TVs, computers, phones, everything. And I know that when I do that, I sleep so much better. So 3 things that you can do from home, those are some pearls that you can take away. But sleep is super important because it does so much for our body. All right, this is what I find interesting is as you look at anthropological studies, so you look at maybe Egyptian tombs and to us at our population now, skeletally, we are different. And what they are attributing that to is the difference in our diet, so nutrition-wise, but also hard food-wise, because we use our muscles to chew, and when we chew, it helps develop our bone. So muscles set the tone for the bone. And so we need to work out those muscles a little bit more. That probably goes for impact on the joints as well and everything else like that. But you can look at things, and a lot of people say, well, I need braces because my mom had braces, so I'm gonna have braces too. There is a genetic correlation, but it's epigenetic. It's how the environment has influenced the way that our genes are expressed. So our environment being pollutants and toxins, inflammatory particles in our food, and softer diet in our food, and less breastfeeding and more bottle feeding. So really interesting that they can actually see a skeletal size difference. I treat a lot of kids because I love that we can affect growth in kids. So we want to positively affect the growth and guide that forward. By age 2, we're 50% craniofacially developed. By age 5, we're 70%. And by age 12, we're 90%. So if we can catch kids in that phase of growth and direct that growth forward, then that's where we can see a lot of benefits. Interesting is we see a lot of more ADHD and more problems for concentration and other stuff. And the study that Dr. Karen Bonnick did, she is a psychiatrist at Albert Einstein, studied 11,000 kids over 6 years, so it's a really pretty big study, and found that over 50% of those kids no longer needed their ADHD medication once they got their sleep under control. Yeah, that's super cool. So if we look at a sleep questionnaire and a ADHD questionnaire, they're almost identical. So is it a sleep problem? Is it an ADHD problem? Not saying that everyone with ADHD medications, they don't need that. There are still some people that do, but a lot of people, once you can get your sleep under control, you can work through a lot of different things. Nasal breathing. So you're talking about mouth breathing, but the importance of nasal breathing, it warms, humidifies, and filters the air. Also, when we're breathing through our nose, it's releasing nitric oxide. So nitric oxide is a vasodilator. It makes our blood vessels bigger, so our heart doesn't have to work as hard against pumping against that. When our tongue to the roof of our mouth, it's helping that when we're nose breathing, it's helping develop that palate, and also the vagus nerve runs along that, and we can stimulate the vagus nerve by putting the tongue up to the roof of our mouth, which then puts us out of fight or flight and more into rest and digest. So I'm always constantly teaching my kids how to cope with their emotions. And one of the things is, okay, well, where's your tongue? Okay, how's your breathing? So you want those slow, deep breaths, and you want your tongue on the roof of your mouth, and that can help calm your nervous system down. So again, about the tongue, this one looks like the tongue never lived up there. Probably looks like a thumb lived up there instead. And this one, the tongue has nicely shaped the palate. And you know, even if we have space for wisdom teeth, that's great. The floor of our mouth is, or the roof of our mouth is the floor of the nasal sinus. So getting that broad palate can also help us get straighter septums. So it's hard to correct an adult, but that's again why I like treating kids, is because if we can develop that well, then we are reducing the risk of deviated septums. I do a lot with cranial manipulations. Here's my friend, we'll call him Frank. I don't know why it's a he, but there are 22 bones in the head. Where those bones meet is called a suture. Those sutures should be slightly movable. But if we've had trauma or other stuff, they can get locked up. When things get locked up, we can get some torsion. And so if we want things to hold better, we need to release the stress in the sutures. And we also need to line up the teeth well. So that's where I can help out with both. And what's great is we can set a pretty placement of the dinner and a pretty centerpiece. But if the dinner table is off center, that centerpiece is not going to hold as well. So chiropractic come into play with that.
You're here.
There you go. I work on airway development for all ages, kids and adults. And the goal is to get stronger, wider, more open airways. And we always start joints, jaw development, and then teeth placement. So, and we do that with changing the structure of the mouth, and then also changing the soft tissue structure. I work a lot with jaw pain patients, clicking and popping and other things like that. Clenching, tension, migraine headaches, and so the teeth are one of the only things in our body that when they come together, that signal goes straight to the brain, and so that changes the way that our muscles are firing. It doesn't have to synapse too much to get to there. So our teeth dictate where our jaw goes, but if our jaw happy position is different than our teeth happy position, we have to bridge that gap. I bridge that gap with an appliance in the mouth, but what that does is it just helps balance the system. And then now that we know we have a roadmap of where the jaw wants to go, we can figure out how to move the teeth to match that position. So the teeth happy position and the jaw happy position match, and now you don't have jaw pain.
Get you on roll some like nautical terms.
Yeah, so it is like an airplane, but that's like, it's a free flowing joint right here. And so, yeah, it can be in any type of plane orientation there. I call it an orthotic because just like an orthotic in your shoe helps balance out your hips, an orthotic in your mouth can help balance out your jaw. And that jaw, we have a lot of descending problems. So that jaw is out of alignment, that can throw the shoulder out of alignment, can throw the hips out of alignment and down. Things can travel up the chain as well, but that's why it's great to work in tandem with people, with body workers, with chiropractors, because again, we want to set this straight, but then now we need to undo this compensation so that we can have the whole body in alignment and that whole nervous system can turn on. So it's really amazing because once you can get the jaw in the right position, strength changes and sometimes the vision can increase and other things like that. I don't promise those things because I'm not an eye doctor, but just by aligning that jaw, we feel a lot of positive changes in the body.
Can I ask a question?
Go for it.
So in these two pictures of the teeth, are they both in alignment now? One's without an orthotic and one is with, right?
So yeah, this one is without, and you can see that the jaw is in a different placement. So if you're just looking at the midlines, so the teeth are causing that jaw to kind of slide off to the side, which then is probably going to compress and cause pain in that joint. Once we can get that jaw in a good position and balance that with an orthotic, we see that things straighten out and the pain goes away. So this is someone in pain over here, and this is someone in decompression phase over here.
Okay.
And then once we take this orthotic out, we see, can you stabilize to that point, or do we need to move the teeth to match that position? And oftentimes I get a longer, more stable result in moving the teeth because if the teeth are tipped slightly inwards because the lips and cheeks are being overactive and the tongue isn't doing its job, those teeth are tipped inwards. Just by operating those teeth, we get this much extra height and jaw decompression here. So I prefer to move the teeth in the end, but that is an additional phase of treatment. You're going into orthodontic work and it takes more time. So I always go back to what's the chief complaint of the patient and how can I help them best.
Okay. Yeah. So the teeth on the left side, I mean, it's the same person, but their teeth are inward more.
Yeah.
And that's
so
also contributing to the pain.
Yeah. So you can see here, you see that shift here. Here's that midline.
Yeah.
Then now we have that jaw lined up, those midlines lined up. So now we need to figure out how to move the teeth that position. You can see that with this orthotic appliance, you get this much extra what's called vertical. So when we move the teeth, we want that much extra vertical. So we just want everything, all the systems in balance. We really look to see how can we reduce clicking and popping, because the clicking and popping is that disc. So when we're good, that disc follows that jaw. When we're clicking and popping, okay, back on, okay, and then back on. And so we want things to be fluid and together. And it took probably a person a long period of time to get to that clicking and popping pain. It will take a while to undo that, 3 to 5 months to undo that. But the goal is to get that disc in a good position and then let it heal there because it's held on by ligaments and it takes time for ligaments to heal. So we need to let the ligaments heal. We increase that healing with lasers that can just help regeneration and rejuvenation. We have intraoral massage and nutrition and other things to help with that. But trying to get the muscles, joints, discs, and everything else in alignment. Teeth as well. Yeah.
Is the procedure to find out if you're out of alignment, is it fairly simple? Is it a matter of an x-ray? Like, how do you know if someone's out of alignment? I'm assuming there's lots of people who probably are and don't even know.
Yeah, so great question. Pain is what sends most people to my office. So if they're in pain, they're like, I want to get out of pain. But you're right that a lot of people are probably just going around, being fine, oh, it's clicking and popping, but it's not painful. But when is that going to be painful? Can we do something to correct it now before the straw on the camel's back while you're in Hawaii on a trip? So clicking and popping would be one thing, pain, another thing. Maybe your bike just doesn't feel even. And as far as testing goes, I do an exam and then an x-ray. Generally the x-ray is enough for me to see because I do a 3D x-ray that allows me to see that. There are some complex patients where maybe we need an MRI and we have to go into the hospital for that. But most patients that come through my office, we can diagnose that just with range of motion, listening to the sounds of the clicks, evaluating their head, and looking at that in the x-ray. Yeah. So if you're in pain, don't wait, or if you are locked open, can't close your mouth, or if you're locked closed, can open your mouth. The sooner you get help, the better, because that means that that disc is out of place and that ligament is being stretched. And the sooner that we can unstretch that ligament, the faster that the ligament is going to heal. Good questions though. So I was talking about laser therapy. I do laser therapy to help with the rejuvenation. It targets the mitochondria and it increases ATP turnover, so you get faster cell regeneration, better blood flow, better nerve flow. Lasers are awesome. My kids think I'm obsessed with my laser. Okay. I can also use that same laser to help get a myofascial release. So fascia surrounds all the muscle tissue, and if it's tight, then you're not getting good blood flow, good nerve flow, and you might have spasm. But if we can heat that up to 40 to 42 degrees Celsius, we can get that hyaluronic acid crystals to melt. We can get that actin and myosin to stretch a little bit more, and then you get release of that tension. Since this whole area and your neck stabilizes, your shoulder stabilizes your jaw, when I see jaw pain patients, we're often doing this whole area to release them. So I was talking about the importance for the tongue. The tongue is very important, but what if you're an adult and you never had your tongue up through your mouth, you're a mouth breather, you have this narrow arch? Are you sorry out of luck? No, we can still expand that, create room for the tongue, and then train the tongue to go in the right spot. I do my expansion non-surgically, and I really liked the results I can get with clear aligners. Similar to Invisalign. I often use the brand called Candid, but just something to develop that arch to get you more structural space. That same laser that I think is so cool, I can also tone, tighten, and lift that soft palate and tone and tighten that tongue. And so now you can breathe better and less snoring. If you think
I did that.
There you go. How was it?
I can't show the increased hair because it didn't affect that, but it definitely helped.
It definitely.
My wife's happy.
There you go. The hair is a personal touch motivation. If you can imagine the tongue being, or the airway kind of being pulled tight like a balloon, you get it. That's the soft palate and the tongue vibrating against each other. Well, if we can tone, tighten, and lift that, boost that collagen, and tone and tighten that tongue, now we're getting more of that space. So it's great for snoring, great for sleeping issues, Outpatient, we don't have to cut away tissue, it's not painful. There may be instances of hot, but it goes away once I move spots over there. So I really like that. As we age past 30, every year we lose 1% of our collagen, which is not fun. But that's why getting the laser treatment can boost that collagen. Can also be done on the face, but don't look at mine because I haven't. I also use oral appliance therapy to help open up that airway. You can see if this person has their mouth open, their jaw falls back and it closes off that airway. But by holding that lower jaw forward, that can increase the airway, and it is FDA approved to treat mild to moderate sleep apnea. So different mandibular advancement devices. Mandible, lower jaw, advance forward, getting that tongue up and out of the airway. And that's how you can breathe better at night. I test my patients that come through, actually whether they're for jaw pain or whether they're for sleep. I still do a sleep screening with them because jaw pain and sleep problems go hand in hand 90 to 95% of the time. Unless you had like an acute injury where you were like hit, yeah, maybe you didn't have a sleep problem that caused that jaw. But the body as a protective mechanism will clench or grind to help open up that airway. And that's what is propagating some of those jaw pain problems. So I'll do a sleep screening with my patients. And what I like to see is what is the original cause of all these issues. Instead of just throwing pharmaceuticals at the different problems that I have, what is the root cause of the problem? Now, airway dentistry is a big piece of the puzzle, but it's not the only piece of the puzzle. But I do see a lot of issues that can resolve once we can get sleep under control, once we can mix that mouth breathing habit, and once we can teach harmony to the muscles. So thank you for listening to my presentation. If you have any questions, definitely feel free to let me know. But this is my contact information. You guys can reach out to me with any questions. I'm on Instagram and Facebook. You can reach out to me that way as well. Or I'm just across the street from this. So,
Question on CPAP, it's very popular.
yep. What do I think of it?
Yeah,
I don't mind it as a rescue device, meaning if you have it while we're trying to
some people
develop
use it
that
for
option.
us, some people use
Well,
it.
that's what I've heard some things, and once you go on it, you just
So,
like,
yes.
you're there for life.
I don't like it as a long-term option. I don't mind it as a rescue device. Let's get you breathing now while we sort out the other issues, while we work on nutrition, while we work on developing that airway. But as a long-term device, it actually can cause complex sleep apnea because you've had air being shoved down your throat all the time. Now your brain's like, oh,
And it is to the mouth and not to the nose, right?
so you can have nasal pillows, you can have a full
You can.
face mask, yeah. But it's shoving air down your throat the whole time, and now your brain's like, oh, I don't have to work, so it stops talking to the breathing muscles. So the breathing muscles shut off, and now you have something called complex sleep apnea, central sleep apnea, which is not treatable with an oral appliance. So an oral appliance can treat obstructive sleep apnea, an obstruction of your airway, but it can't treat the fact that your brain won't open up or won't open up the muscles. That's a neurological issue. CPAPs also, there's been a lot of recalls lately with them because they can grow bacteria, and there's some people who are getting like pneumonia or other issues with that. So again, I don't mind it as a rescue device. I don't like it as a long-term option. And if you can, like these options, they might not cure your sleep apnea, but they will reduce it. And then even if you can turn those pressures down on your CPAP, now you're less at a risk for developing that complex sleep apnea. I like BiPAPs better because it's a not continuous positive airway pressure. It turns on and off and it changes the pressures so that your muscles still kind of have to work.
BiPAPs, I haven't heard of those.
So it's just very, very similar to a CPAP. It's still a machine, but it varies the pressures, and I like that.
Because the thing that gets me worried, it used to be like Medicare type people who are they're putting on CPAP, But we know young people who they're putting it on, and so now the rest of their life, anyways, is kind of.
Yeah, so that's why a lot of people think, oh, sleep apnea, I don't even get tested for sleep apnea, because that's like an old, overweight male disease. But I see young, skinny females with it, and that's because it's a structural problem, and that structural problem is that epigenetic problem of how we're just kind of getting those more narrow airways and arches because of our habits and our environmental factors. Breath is a really good book to read.
Great book.
It's really fascinating, and they go into that about like the Paris catacombs, and even in the same timeline, they have the bourgeoisie and they have like the peasants. And the peasants had to eat vegetables from their gardens, and the bourgeoisie kind of got more of those slightly more processed foods. They weren't fully processed like past the Industrial Revolution. There's even a skeletal difference just between that layer, which is fascinating to me. So, yeah.
I have so many questions. Who wrote Breath?
James Nestor.
Okay. But that wasn't there.
Fascinating book.
I loved it. I thought it was a good read where it kept your attention like well enough, but it wasn't like a textbook.
And the Audible's very
I
good.
just used one of my credits. I'm really going for
It's
it.
so-
Why We Sleep is a great book too.
Yeah.
It makes you feel really good if you're sleeping well. If you're not sleeping well, it really scares you into figuring out how to sleep better.
I really like that book too. That one's more of a textbook read,
Yeah.
but he did put in it, if you're falling asleep while you're reading this book, then at least you're getting sleep.
Yeah.
Yeah, yep. So, and I listened to Matthew Walker speak in person. He's just really engaging and fascinating.
Yeah, everyone try to sleep. Yeah. Cool.
I'm curious about the nutritional aspect of your practice. Are you trying to get people just to eat chewier food to develop these muscles?
So with babies, like here's another thing that you guys can take home and tell your grandkids or anything else that you know have babies. And if you even just get one of those silicone cups that have like, or the mesh netting. Yeah, so that they can eat the foods that you're eating like during dinner and you don't have to put it through a processor or puree it. That's already stimulating their muscles. So no BPs.
So
BPs
to
are
give them
bad.
grace.
Yeah. And then the silicone cups are good. So that's like a quick switch for
Breastfeeding,
infants.
obviously.
Breastfeeding, yeah. And then if you're having trouble breastfeeding, I do some, but for infants, I actually refer out to another pediatric dentist, but he has a IBCLC in office. And so he can do their tongue and lip tie release, and then mom and baby can go nurse in their room right away with IBCLC watching.
So I wondered, I was gonna ask if you do the tongue tie, because we had somebody that had to.
Yeah, so I'll do it on like older kids, but since I have this really awesome resource that has all of the IBCLC in office, I'm like, he's doing it fantastically. Let me just send you over to see Dr. Ritter. So, yeah. But no, tongue ties are a thing too, because it's just that fascia training all the way from the tip of your tongue all the way down to your toes. And so if that's tight there, I got my tongue tie release after reading the book Tongue Tied by Richard Baxter. This was several years ago before I had all my training, but we got it released and my headaches reduced by 75% just by getting my tongue tie released.
So a lot of adults don't even know it, but they still are tongue tied.
Yeah, I'm a little bit more conservative on how I do my tongue tie releases. If you come to me with a symptom, then I'm like, okay, yeah, we can go ahead and release that for you. If you come to me, no symptoms, but you have like a tongue tie, but you're functioning just fine, and you're an adult, I'd say probably just leave it at that point. So yeah, I kind of go back to what patients want now. Cool.
Awesome.
Thank you. Thanks, Dr. Brittany.
Yeah.
And I'm going to end right there.